there, my name is Megan Cloninger. I am the co-owner of Houston Moms. And this morning, I am thrilled to introduce a new series to y'all. We every month are going to be bringing to you experts from UTMB Health, and they are our preferred provider for the Southeast Texas, Galveston, and Bay areas. And so they are going to be covering a myriad of topics as we go throughout 2021, and topics that affect you as moms and as parents and your children. And so today we thought it would be incredibly timely to kick off what is happening in the news right now. And that is all about COVID vaccines. But we wanted to be able to specifically address COVID vaccines as it relates to pregnancy, pregnant women, postpartum, all of that. And so we have an expert with us today, board certified OBGYN, Dr. Elizabeth Cloninger. Thank you so much for joining us, Dr. Cloninger.
Hi, good morning. Thank you for having me.
Absolutely. So can you share just a little bit about yourself and your background and where you practice?
Sure. So I'm from this part of Texas. I was born and raised in Beaumont, Texas, and then I did my undergrad at Texas A&M, class of '04. Whoop. And then I did my medical school and residency with UTMB in Galveston. I was in private practice in the Webster area for several years, and I did work with Houston Methodist at Clear Lake as their medical director for a time. But I'm really thrilled to be rejoining UTMB, where I trained, and kind of what I view as my family, to practice obstetrics and gynecology here in the Webster area. So, and I'm mom to two littles myself. I have two little girls, Isabella and Marion. They are 6, so in kinder this fall with the pandemic. That was exciting, and 2.5. So, and my oldest is a type 1 diabetic.
Okay.
And celiac, so no gluten. So I think that it has been such an amazing experience to be her mom, but also a really great reminder of how it is also to be a patient and there with your child as a patient. So support for all the type 1 and celiac mamas out there.
And you hear about it so much, and it is really, really important that people have that support and those connections. And so I know a lot of our moms will relate to that. And I love knowing that you're a mom too. So as we're talking, you're not just speaking in figurative terms, you're speaking to something you've experienced and are currently experiencing in your practice. And so I think that's super important. So let's just dive right in. So there has been a lot of headlines that are out there, and our point of this conversation is really to help educate our moms and our parents, and so they can make the best health decisions for their family. So first question right off the box, is it safe for pregnant women to get the COVID-19 vaccine? What are we finding right now?
Sure. So the statement from our two, as obstetricians and gynecologists, our two biggest kind of advisory bodies, which are the Society for Maternal Fetal Medicine, I'll abbreviate that to SMFM, and the American College of Obstetricians and Gynecologists, also known as ACOG. Both of those groups advocated for the inclusion of pregnant women in the clinical trials for the emergency use authorization of the COVID-19 vaccines, but unfortunately they were not successful in their lobbying efforts for that inclusion. That being said, they have released a statement that says that the preliminary developmental and reproductive toxicity studies, also known as DART studies, for both the Pfizer BioNTech and Moderna vaccines are very encouraging, with no safety signals reported. The animal studies provide the first safety data to help inform the use of these vaccines in pregnancy until there are more data in the specific population, and they do not show any adverse effects on female reproduction or fetal or embryonic development, basically any adverse effects on the baby's development either. And since those studies were done, we have certainly seen healthcare workers in particular who were pregnant being vaccinated. And so far, many of them have been very open about sharing their experience with the vaccine and how they've done. And those, those anecdotal stories have also been encouraging. They are also working to create registries for pregnant and lactating women to report their experiences with the vaccines and later probably get information as we go along. But the basic thing is there's nothing to suggest that these are unsafe. But we just, since we didn't have pregnant women included in the trials, we don't have data to specifically speak to their safety, but they are believed based on these preliminary studies to be safe.
So if you had a patient, let's say, had pre-existing condition or it's a healthcare worker, what have you, wherever they are falling maybe in that 1B spectrum where we are right now,
Sure.
Are you advocating for the COVID-19 vaccine for them?
So I personally have been, particularly depending on the patient's risk factors. So the data indicate, we do have some data on how pregnant women have done with the virus. And again, it's also very new, but we have found that pregnancy itself is an independent risk factor for COVID-19 disease severity, with an increased risk of ICU admission, mechanical ventilation, need for ECMO and death, compared to symptomatic non-pregnant patients. So basically there is some increased risk. While it still remains low, it is higher for pregnant women compared to non-pregnant women with similar risk factors. So many of the guidelines now from our governing bodies are recommending putting pregnant women in that 1B or 1C category, with pregnancy as its own risk factor. That said, it does have to be balanced with how does the virus look in your local area? What are your personal risk factors? What are your concerns? And so that's why our governing bodies, ACOG and SMFM, really recommend that it be a conversation between the patient and her physician, to talk about, is this good for me? How at risk am I for getting it from my community? How nervous am I? What issues may I have with my own health? And things that would put me at risk. Have I had a reaction to a different vaccine, or do I have any concern about allergies to any of the components in the vaccine? That said, this is not a live vaccine, so the live vaccines are contraindicated in pregnancy, but this is not. It's an mRNA vaccine. It does not enter the nucleus. A common concern is that it can alter the DNA. That is not the case. We know all that from the studies that have been done. So again, I speak to my pregnant patients, particularly those who are at high risk of exposure, and I talk to them, and I always want to hear their concerns, and then I discuss with them, what we know, and then we talk about if they want to try to get vaccinated. The other issue, of course, is availability. The vaccine is becoming more and more available, and so even in the patients who are hoping to receive it, we are working on rolling that out to those patients who are in that tier.
Yes. What did they refer to the other day? The Hunger Games trying to
Right.
this vaccine. So fingers crossed that, the distribution continues to be better. So that's interesting you bring up, being able to get it. Is there a certain time in pregnancy where it may not, like if we're newly pregnant, or maybe we're towards the end of pregnancy, is there a safer quote unquote time to get it?
There aren't any trimester specific recommendations like first, second, or third trimester, though it is recommended that you don't take the vaccine if you're acutely ill with something else, right? Like with any other vaccine, you wouldn't necessarily go and get your flu shot if you were under the weather. That would not probably be the time you would want to get it. The same recommendation exists with this one, but no, so far there aren't any trimester specific recommendations. We do recommend, fever can occur more commonly with the second vaccine. It was still a relatively low percentage for both types of vaccines, but we do recommend pregnant women treat that fever with acetaminophen, Tylenol, which is safe in pregnancy.
Okay, so. Perfect. What about our mamas that have given birth and they're nursing mamas now? So
Absolutely.
What does vaccine look like for them?
Yeah, so we recommend the vaccination for for lactating moms and postpartum moms, both moms who are breastfeeding or not. And that's one, to help decrease the risk to their own household and also to decrease their own personal risk. Again, we always have to counsel regarding the lack of data for safety and their individual risk for infection and severe disease, but it is believed that the theoretical risks really do not outweigh the benefits, particularly in postpartum moms.
I think that's so comforting.
Yeah, absolutely. Absolutely. And again, there are some registries being developed. There's the VSafe registry, which everybody who gets a COVID vaccination is able to enter. I registered for it. I had, my parents were in the 1B group and got vaccinated. I think I had to help them with it's a phone app, but they also, I think, are submitting, how they feel. It basically asked me almost every day how I was feeling, what my symptoms were. Did I have anything that made me unable to do work or anything like that? So there's that registry, but there's actually a separate registry that the University of Washington created for pregnant and lactating women receiving the vaccine. So I think as that goes out, more and more women will be submitting how they're doing, and we'll have more data available in the coming months.
That's great. And that's basically an app where people go and kind of track how they're
Correct.
feeling each day after they get it. And then, especially after they have that second one, which,
Right.
We hear the second one is maybe a little bit more tough on the system, like you indicated with the fever, maybe a little bit more of a chance of a fever or things like that, right?
It definitely can be. I will say, like, on a personal note, I received both vaccines. I was very fortunate to do so. Because of course, as a mom and as a physician, one of my worries has always been, the risk that my family has to take just by living with me. So it's been months of changing in the garage and immediate showers and all those sorts of things. And this was definitely a little bit of relief. That said, I did have some side effects with the second vaccination, but they were short-lived and responded well with Tylenol. So I can speak from a personal note too, and everybody's different. I had colleagues who really didn't even notice, that they had any kind of side effect from it. So every person is a little different, but yes,
Right.
We recommend it with lactation and postpartum. And we certainly say there's no time in pregnancy that we think that you could not have it.
I think that's so hopeful, at least for me. I mean, and especially I think of all of our healthcare workers who do. I mean, you're basically taking a chance every time you go to work, more so than some of us. So I'm so happy for you, and they're able to get that. I'm sure that's a big relief, especially with your little ones at home. So what about our moms who are starting to kind of family plan? And, it's an interesting time, I think, to be family planning in the time of COVID, but should they time their vaccine around getting pregnant, perhaps thinking about getting the vaccine before they get pregnant? What are your thoughts on that?
Sure. So I can tell you kind of what the recommendations have come out. That the recommendation is that a pregnancy test prior to vaccination is not recommended, and there aren't really any data to guide any timing of conception following vaccination. But the general idea is, of course, that being vaccinated prior to pregnancy helps in having immunity and avoiding infection while pregnant. So certainly in women contemplating pregnancy, we do think that vaccination will be helpful to them for their future health. So we just again, same deal. We don't have a ton of data on the matter, but we think more than likely an ounce of prevention is worth a pound of cure.
I mean, it's kind of like when you're thinking about getting pregnant, or at least for me, it was a very I was in vitro, so it was very specific. So I had to do all of the tests, make sure I was completely healthy and my body was as good to go as it could be prior to getting pregnant. And so this may be one of those things that we eventually add to the list of, well, have you tested or have you gotten your vaccine or what have you before maybe starting some of those things. So interestingly enough, so we think about nursing mamas and passing on all those great immunities and whatnot. Do we know anything about maybe if you get vaccinated when you're pregnant, whether it's past any of those benefits extend to your newborn at all? Do we have any data?
We're certainly hopeful that some of that passive immunity could be communicated. I think we're still very much in the beginning phases of studying that, though I expect there will be more and more data coming out in the months to come. But the hope would be that, yes, perhaps that some of that passive immunity is there, like it would be with, for instance, the tetanus, diphtheria, and pertussis, the whooping cough, vaccine that we recommend during pregnancy, partly also for babies' protection. But a lot of that, I think, is still very much, being studied. So I'd have to defer to the immunologists and epidemiologists and our maternal fetal medicine specialists for better views on that.
Gosh, that would be such an amazing thing, though, because we worry about everything when you bring home your newborn. I mean,
absolutely.
And
Absolutely.
I can't even imagine. I had NICU babies, and so you didn't want it, like, do not get in their face, don't even breathe on my child. And so I think, again, it's one of those fingers crossed situation during these times of COVID. So as we kind of talked about with, different headlines that have come out and, a lot of, information out there, a little bit of misinformation. What is your recommendation on how women can stay up to date on what's happening, especially if they're pregnant, trying to become pregnant, postpartum? Because everything seems to change so quickly and we're learning new things every day. So what would be your recommendation so that people can stay as educated in the process as possible?
Sure. So certainly the CDC and the WHO put out a lot of information, but specifically targeted to the OBGYN population, Society for Maternal Fetal Medicine and the American College of Obstetricians and Gynecologists, they are posting updates and letters real time, as often as weekly. There was an update just 2 days ago posted to the website in response to the headlines about the WHO's statement that they really can't make a strong recommendation for or against just because, again, of the lack of limited data. And both those societies are updating live in real time with experts in those fields to really give good guidance. And that's publicly available information. You can go to the website as a patient and look to see what their statement is. And also just, on discussion with your physician, our institution, UTMB, a lot of our maternal fetal medicine specialists have done a lot of work on COVID and pregnancy and have come out with some amazing guidelines and recommendations that, I have used to help guide decisions in my patients. So UTMB itself sometimes has our own experts speak. A lot of institutions will have the same, but certainly the governing bodies, the Society for Maternal Fetal Medicine and the American College of Obstetricians and Gynecologists post a lot of helpful, salient information for, pregnant patients, for postpartum patients, for women planning to conceive. But it's always worth, asking your own physician too, because they can often guide you to, what the latest is. And that changes, it changes day to day, week to week. We certainly get weekly updates about changes within our community, what the numbers are doing, all that sort of thing. So there are a lot of good resources, but I would point to the major institutions because they're certainly looking at a larger volume of that data and then using that to make a level-headed recommendation.
I think that's so important, going to those primary sources, because we so often, and I'm guilty of this too, we scroll the headlines or we have the news playing in the background and we hear a snippet of, 1.5 minutes of what is truly not the whole entire story. And so, and I think talking to your own physician who knows your story, knows your particular risk, knows kind of what your goals in healthcare are, would be a very salient suggestion too. So, is there anything additional that you want to mention with COVID and vaccine as it relates to pregnancy?
I think that is mostly it. On a personal note, I will say, because I sat there, and I sat with the rest of America watching as the vaccines were being developed, and you certainly, anything that's new, I think physicians, we tend to be pretty cautious. So as we were watching it, it was, well, are we going to give this enough time? And I will say, the clinical trials that were done, yes, there was a lot of work in areas of funding and expediting the research, the things that normally take longer in that regard, that was sped up because of the immediate need. But certainly as far as the actual research and time spent on safety and all that, that was given the appropriate amount of time. And my husband and I talked about it, and I remember I said, can you imagine? I understand it would be a very difficult choice for a pregnant patient to make the decision. For me, if I was currently pregnant during the pandemic, certainly I think the vaccine on a personal level would be something that, again, I would probably consider the benefit outweighing the risk. Particularly being someone that, I'm working with pregnant patients, some of whom are, sick with COVID. But it's very much a personal decision. The statement from our two main bodies also recommends we support women if they are anxious about the vaccine or if they choose not to have it. We are there to advocate and provide the best information, but we also respect, every patient's autonomy and their desire to make the right decision. We want it to be a conversation that patients feel comfortable having. Please feel free to ask us. Know that we are tirelessly reading and keeping up and all that to try to get you the best information that we can, because we very much take seriously, the responsibility that our patients feel to their babies, and we're there for that journey with you, and want to have the safest, healthiest pregnancy journey that we can help you to have. So that would be my thing. Just please don't stew in silence. Ask us as physicians, any questions that you may have, and we will do our best to get the most relevant, most helpful information to help guide your decisions. But at the end of the day, we respect what decision that may be.
I think that's the perfect summation, to be honest. And I think if you don't have a gynecologist or a doctor that you feel safe and comfortable asking those questions, then it might be time to look elsewhere. And so I love doctors who are willing to sit and have the hard conversations. And, especially if we're pregnant, we're entrusting 2 minimum of people with you, ourselves and our unborn. And so we appreciate you and your time and everything that you are doing for our Southeast and Bay Area community with UTMB Health, taking care of our mamas down there, and just being a healthcare worker right now. We appreciate your time and your sacrifice. So appreciative. When we post this video, I am going to link UTMB's resources. So their website and all the places you can go that you can get the latest and greatest information. Also, if you're in the market for a new doctor, they have specialties, hundreds of specialties across those areas in multiple different locations. And so this might be a good time to start exploring that too. So I'll make sure to post that after this video. Again, Dr. Cloninger, thank you so much for your time today, and stay safe, and we will see you soon.
Thank you so much for having me. I really enjoyed it.